What if the health issue you've been brushing off for years was quietly changing your brain, even leading you toward dementia, one unnoticed symptom at a time? Not next year, not next month, but today, right now, it might be happening, and no one sees it. It starts small, a forgotten word, a lost key, a nap that feels too long. Most people shrug it off, as normal aging. But what if those little things were actually signs of something much bigger? In this video, we'll uncover 9 hidden health conditions that seem harmless, but have been directly linked to long-term memory loss in people over 60. And more importantly, you'll learn what you can do, right now, to stop them from silently stealing your memory. Pushpin and stay with me, because halfway through, I'll reveal the one subtle symptom doctors say shows up years before diagnosis, but almost everyone misses it. Imagine looking at someone you love, and realizing, one day, they no longer recognize you. That moment doesn't come out of nowhere. It begins with the things we ignore. And hey, if this message matters to you, or someone you love, please consider tapping the like button, and hitting subscribe to Senior Health Tips. Your support helps us reach more families, protect more minds, and build a wiser, healthier future, for everyone over 60. Backhand index pointing right. Let's begin with the most overlooked, yet most dangerous one of all. 1. Hearing loss, the silent thief. It starts small, almost unnoticeable. You miss a word here, a phrase there. Maybe you think the television is mumbling, or your grandkids talk too fast. But what's truly happening is that your brain, over time, is straining, stretching to fill in the gaps. That silent effort? It's exhausting. When your ears go quiet, your brain gets louder. It starts overcompensating, working double time, trying to catch sounds, read lips, interpret tone. This robs resources from your memory, from your decision-making, and from your peace. What once felt like just a little hearing trouble begins to chip away at your mind, day by day. And it doesn't end there. When you can't follow conversations, you stop having them. You start saying no to dinner invitations, you start avoiding phone calls. Isolation settles in. And isolation, for the aging brain, is like a closed window in a stuffy room, it suffocates clarity. Studies have shown that untreated hearing loss leads to faster cognitive decline and can even shrink the auditory cortex. Your brain needs stimulation to stay sharp, and sound, quite literally, feeds your mind. Hearing aids today are discreet, affordable, and easier to use than ever before. There's no shame in using tools that protect your most precious asset, your mind. Hearing loss isn't just about the ears. It's about connection, confidence, and cognition. The longer it goes untreated, the higher the risk, up to 3 times more likely to develop dementia. White heavy checkmark if this is making sense, or if you've seen it happen to someone close to you, leave us a comment below, and don't forget to subscribe. It helps us bring you even more life-changing health tips. Backhand index pointing right. But what if the danger isn't in silence, but in sadness? In the next part, we explore a hidden fog that can quietly rewire your brain from the inside out. Don't miss it. 2. Chronic depression, the fog that lingers. Depression doesn't always feel like sadness. Sometimes, it feels like nothing at all. Just a heavy, gray weight that lingers through your day, dulling joy, flattening energy, and fogging your thoughts. For seniors, especially after loss, isolation, or illness, this emotional fog can become chronic, and dangerously overlooked. Here's what many don't realize: long-term depression changes your brain. It shrinks the hippocampus, disrupts neurotransmitters, and weakens the pathways used for memory and decision-making. In other words, depression isn't just how you feel, it's how your brain functions. And here's the kicker: depression often disguises itself in seniors. It shows up as forgetfulness, apathy, sleep problems, or unexplained aches. That's why it's so important not to ignore these signs. You're not just protecting your mood, you're preserving your mind. The good news? Depression is treatable at any age. Talk therapy, medication, regular movement, sunlight, and social connection, these aren't just feel-good suggestions. They're brain-saving tools. White heavy checkmark if something in your life has felt off for a while, say it out loud, share it in the comments, or ask your doctor. You deserve clarity and calm. Backhand index pointing right coming up next, a common condition that hides while you sleep, and silently robs your memory. Wait until you hear how it works. 3. Sleep apnea, the brain's sleepless thief. Snoring isn't just annoying, it's a warning siren. Sleep apnea occurs when your breathing stops and starts during the night, sometimes hundreds of times. And with each pause, your brain is momentarily starved of oxygen. A patient once told me, "I wake up feeling like I fought a war in my sleep." That's no exaggeration. When the brain doesn't get enough oxygen or deep rest, it can't clean itself. It's like living in a house where the trash never gets taken out. Deep sleep is when your brain restores itself. It files memories, clears toxins, and sharpens mental focus. But when that's interrupted night after night, the damage builds, quietly, but powerfully. Over the years, this has been directly linked to increased risk of dementia. The hopeful part? It's manageable. CPAP machines, better sleep posture, oral appliances, even weight loss, these are simple changes that can protect your brain from nighttime assault. White heavy checkmark know someone who snores loudly or wakes up exhausted? Don't ignore it. Share this with them, it might change their life. Backhand index pointing right, but what if the threat isn't hiding at night, but lurking in your daily diet? Let's talk about a deficiency that quietly starves the brain. 4. Vitamin B12 deficiency, the forgotten fuel. Imagine running a car without oil. It may start, but eventually, the engine wears down. That's what a B12 deficiency does to your brain. We had a senior patient, bright, independent, who started putting canned soup in the dishwasher. His memory wasn't failing from age, it was starving from lack of B12. Vitamin B12 helps produce red blood cells and supports your nervous system. When it runs low, nerves misfire. Memory becomes hazy. Mood swings take hold. You may even struggle to balance while walking. As we age, our stomachs absorb less B12, especially if we take antacids or certain medications. But a simple blood test can reveal the problem. And with supplements or injections, many symptoms improve within weeks. White heavy checkmark if you felt mentally foggy, tired, or unusually forgetful, don't wait. Ask your doctor about B12. It's one of the easiest fixes with the biggest impact. Backhand index pointing right next, we'll explore something far more common, and more dangerous, than people realize. It's called type 2 diabetes, and it doesn't just hurt your body, it harms your brain. 5. Type 2 diabetes, sugar on the brain. We all know diabetes affects the body. But very few understand what it does to the mind. One woman I treated managed her blood sugar poorly for years. She was bright and capable, but one afternoon, she put napkins in the medicine cabinet and tried to plug her phone charger into the toaster. Her son thought it was a joke. It wasn't. The brain relies on steady glucose and proper insulin signaling. But when blood sugar is out of control, the brain's wiring starts to misfire. Think of it like trying to run a symphony on static-filled speakers. Scientists now call Alzheimer's type 3 diabetes because of the damage sugar does to the brain over time. Diabetics are up to twice as likely to develop dementia if the disease is left unmanaged. White heavy checkmark know someone who's been ignoring their blood sugar? Send them this video. What they don't know could be slowly unraveling their memory. Backhand index pointing right up next, the silent eraser that destroys your brain's blood supply, without a single symptom. 6. High blood pressure, the pressure you can't feel. They call it the silent killer. I call it the silent eraser. Because high blood pressure doesn't just affect your heart, it quietly chips away at your brain. One gentleman came in with just a little forgetfulness. We later found signs of multiple mini-strokes, none of which he had ever felt. They had been silently carving into his memory for years. High blood pressure weakens the tiny blood vessels that feed your brain. It leads to microbleeds, reduced oxygen, and long-term damage, especially in areas tied to memory and focus. But the good news is, this is one of the most manageable risks. With regular checkups, healthy eating, movement, and medication when needed, you can keep your brain sharp. White heavy checkmark. Don't guess your numbers. Know them. The sooner you take control, the more of your mind you protect. Backhand index pointing right. Coming up, we expose the invisible fire that starts in the body and ends in the brain. 7. Chronic inflammation, when the body turns on the brain. You can't always see it. You might not feel it. But chronic inflammation is like a slow fire under your skin, and it burns up more than just your joints. We've seen patients with arthritis or gut issues who begin to forget names, confuse objects, or lose their emotional balance. That's not coincidence. That's inflammation reaching the brain. When your body is in a constant state of alert, it floods the brain with chemicals meant to help in emergencies. But when those chemicals never shut off, they become toxic to brain cells. Neurons misfire. Memory fades. Personality shifts. Anti-inflammatory habits, like eating turmeric, oily fish, leafy greens, and avoiding processed food, can protect your mind more than most people realize. White heavy checkmark. If your body has been fighting pain, stiffness, or autoimmune flares, now is the time to act, not just for comfort, but for clarity. Backhand index pointing right. Now, let's talk about something most people think is just tiredness, but could actually be a glitch in your heartbeat that silently starves your brain. 8. Atrial fibrillation, when the heart and mind fall out of sync. The heart and brain are dance partners. When one falls out of rhythm, the other loses step 2. A retired teacher I knew said she felt off 4 months, tired, forgetful, a little dizzy. When she was finally diagnosed with AFib, it turned out her brain had been starving for oxygen intermittently for over a year. AFib, atrial fibrillation, causes your heartbeat to become irregular, which affects how blood and oxygen reaches your brain. It's linked not only to stroke but also to subtle, long-term cognitive decline. The tricky part? Many people don't feel symptoms until the damage is well underway. That's why regular heart checks, medications, and rhythm control are key. White heavy checkmark. If you, or someone you love, has a fluttering heart, don't ignore it. Protect your heart to protect your mind. Backhand index pointing right. Finally, we turn to the most surprising threat of all. A condition dismissed for decades as harmless, but can trigger dramatic, sudden confusion in older adults. 9. Frequent urinary tract infections, the hidden trigger. Most people think of UTIs as annoying, not dangerous. But in seniors, repeated urinary tract infections can become brain bombs. I once spoke with the daughter of an 82-year-old woman. One morning, her mom calmly called 911, claiming their dog was spying on her through the walls. She wasn't hallucinating from dementia, she had a UTI. In older adults, UTIs often show up without pain or fever. Instead, they trigger a condition called delirium, sudden confusion, paranoia, even aggression. It can look like dementia. But it's not. Left untreated and repeated often, these infections can contribute to lasting brain changes, especially when other health conditions are present. White heavy checkmark. Stay hydrated. Keep clean. If someone suddenly seems off, ask about a UTI. You might be catching something far bigger than a bladder infection. Backhand index pointing. Right. Now that we've uncovered all 9 hidden dangers, let's pull back and talk about what you can do, starting today, to protect your memory for years to come. Final thoughts. The body whispers before the mind shouts. Dementia doesn't always begin in the brain. Sometimes, it starts in the ears, the gut, the joints, or the heart. These 9 conditions are not just physical, they are neurological invitations, paving the way for confusion and decline. But here's the good news, many of these are preventable, manageable, or reversible, if caught early. So don't ignore the small things. Don't brush off just being tired, or a little forgetful. The earlier we act, the more memory we can preserve, and the more of you we can protect. Here are a few key takeaways. White heavy checkmark: get regular checkups, early detection of hearing loss, high blood pressure, and vitamin deficiencies can make a world of difference. White heavy checkmark: stay connected, isolation is the enemy of the mind. Stay socially active, emotionally engaged, and open to support. White heavy checkmark: move every day. Even a 15-minute walk helps reduce inflammation, support circulation, and stimulate brain function. White heavy checkmark: feed your brain. A balanced diet rich in omega-3s, greens, berries, and clean proteins protects your brain long-term. White heavy checkmark: ask questions. If something feels off, mentally, emotionally, or physically, don't wait. Speak up. Ask. Investigate. Remember, your brain is not a separate part of your health, it's connected to everything. By taking care of your whole body, you're giving your brain the best chance to thrive. White heavy checkmark: if this video helped you, please support us by hitting the like button, leaving a comment below, and sharing this video with someone you love. It might just start a conversation that changes a life. Bell, and don't forget to subscribe to Senior Health Tips for more life-saving, brain-boosting videos made especially for older adults who want to take control of their health. Movie camera up next, daily habits that defend your brain well into your 90s. Trust us, number 3 is something no one talks about, but everyone should know.